Ortopedi uzmanı Doktor Kaloyan Petrov, Lordship Lane'de bulunan You Kliniği'nde hastalarını görmeye devam ediyor efendim. Çocuklarda yürüme, yetişkinlerde tendon yaralanmaları, eklem rahatsızlıkları ile ilgili önemli bilgiler veriyor bizlere.
I am Dr. Kaloyan Petrov, orthopedic surgeon. I've been working doctors for you in the last 6 months, but my whole orthopedic experience is more than 20 years. Bulgarian by origin and studied medicine in Varna Medical University, specialized orthopedics subsequently and worked in several countries. Worked in England for NHS for about 12 years. I'm competent in all orthopedic subspecialties, including hip, knee problems, hand and feet, spine, also children orthopedic problems. The main reasons I see people is arthritis or tendon problems. Arthritis is wear and tear of the cartilage. It affects any joint, but it's mostly knees or hands, what I see here in our clinic. It is a complex problem, and the simplest way of explaining that is thinning the cartilage lining, which causes instability of the joint and slow destruction of the joint. Unfortunately, there is no cure for this problem, but there are several ways to slow down the progression of the process. With what we advise in the first instance is activity modification, avoid high impact contact sports or heavy lifting, but in the same time stay active with low impact sport activities like jogging, cycling, swimming are excellent ways to keep yourself fit. And it's very important to keep patients' weight under control. We can assess the joint inflammation with ultrasound, this device here, which is very handy because we do it on the spot, and it takes a few minutes, it's painless. It assesses whether there is any significant tendon or ligament involvement, whether there is inflammation. If the pain is really bad, we can offer what's called steroid injection. It's an anti-inflammatory medication. We inject that medication under ultrasound guidance that improves the accuracy. Also, another way to slow down the progression of the arthritis is what's called viscosupplementation or injection of jelly-like material called hyaluronic acid. Again, we do it under ultrasound control that makes it very precise and less painful. So these are ways to slow down the progression. Unfortunately, there is no cure for that, but many people live many years without any significant impact on their quality of life. Of course, the end stage treatment of the arthritis is joint replacement, and we can discuss these options when we assess the patient, what's the best way to deal with the problem. Another very common problem we see here is tendon injuries or tendon inflammations that usually affect younger people or people who involved in a heavy sports or a heavy physical work. Affects mostly shoulders and elbows. People notice they struggle to reach the top shelf job or struggle with some repetitive manual work. That's usually a result of years of repetitive minor injuries that cause thickening of the tendons or micro tears or accumulation of fluid around. Again, with the ultrasound we have here, we can assess the quality of the tendon. It's very important to see if the tendon is completely torn. In that case, we need to talk about having an operation. Or if it's partially, which is often the case, we can treat it with activity modifications, avoid the painful activities, strengthening exercises. Again, precisely place the steroid injections or what's called platelet-rich plasma or PRP injections when we take blood from the patient and concentrate the growth factors, inject it under ultrasound guidance in the inflamed spot. That usually helps with the recovery. So it is not one treatment that helps all, but it's all tailored to the specific patient and specific problem. We also see children. The parents are always worried about deformities affecting mostly their legs. It's very important to ultrasound scan in the first few weeks after the baby is born to make sure that the hip is not unstable, or to make sure that the hip is well developed, as if we miss that condition called congenital hip dysplasia, that can lead to very difficult problems later in life, with limping, delayed onset of walking. It's a simple test that can avoid serious problems later on in life. Most of the children's feet deformities are innocent, and parents just need some reassurance from a competent practitioner. Back pain and sciatic pain is another very big group of patients I see here. It is a very difficult problem to treat, as there is no single treatment that helps everyone. It is usually a result of years of repetitive injuries, usually combination of exercises, physiotherapy, activity modification is what helps. Surgery is rarely the answer for these chronic problems, usually provide short-term benefit, but of course in certain situations that's what needs to be discussed. We work with imaging center in central London, which can provide very affordable and very quality MRI service, and that complements our assessments. I work in Doctors for You usually on Sundays, and if you plan to see us, please call the clinic and they will provide appointment for you.